Welcome all beloved students. In this tutorial, this is the second lecture of the central nervous system. In the first lecture, we have discussed about central nervous system cells. Now we will discuss anomalies. First of all, we will discuss four brain anomalies. Four brain anomalies, it means forebrain, midbrain, hindbrain. So we will discuss the four brain anomalies. The first anomaly is holoprosencephaly. These lectures are very important for you, dear students, for your USMLE preparation or for medicine lectures. These lectures are important. Listen to these lectures. If you cannot watch the videos, try to download it in audio form, but listen these lectures. It will give you a clear idea about the concepts of pathology, and pathology is a backbone of the medicine subject. So let's start this topic. The first topic is holoprosencephaly. Holoprosencephaly. Holoprosencephaly means what? First of all, we will discuss the normal brain having two hemispheres. One is right hemisphere and one is left hemisphere. And these two hemispheres means the brain is divided into two hemispheres by which gene? The gene is called sonic hedgehog gene, SHH, sonic hedgehog gene, and it is a morphogenesis gene. Morphogenesis means it is a formation gene, structure formation gene. And the functions what this gene perform, what are the function of this sonic hedgehog gene. Dear students, beloved students, its function is patterning of the limbs, mean giving a proper pattern to the limbs. Patterning of the midline structures means the structure present in the mid of the body like brain, spinal cord and face. Got it? So normally the brain is divided into two hemispheres by the sonic hedgehog gene, and it is a morphogenesis gene, and the functions are patterning of the limbs, patterning of the midline structures like brain, spinal cord and face. But beloved students, when there is a mutation in this gene, the morphogenesis is disturbed. So there is no right and left hemisphere when there is a sonic hedgehog gene mutation. Dear students, when there is no right or left hemisphere, so there is mostly a monoventricular cavity. Monoventricular cavity means instead of two ventricles, I mean the two lateral ventricles present in the forebrain, there is a presence of a single monoventricular cavity. Got this? The other features are cyclopia. Cyclopia mean that this fetus or this the one having a sonic hedgehog gene mutation, he will born with a single eye, and the mouth and nose will not develop properly, means ill developed. And cyclopia are associated with the one having trisomy 13 Patau syndrome. If somebody they're having a trisomy 13 also called Patau syndrome, or the maternal diabetes mellitus means the mother having a diabetes mellitus, or the newborn having trisomy 13 called Patau syndrome, they will born with a single eye, ill-developed mouth and nose, and this is called cyclopia. And the one hemisphere present instead of two, it is called holoprosencephaly. You can see in this picture, I will provide this picture in PDF. Try my students contact me in through email or WhatsApp. I will provide all these notes and all these kind of stuff important for you. There is a holoprosencephaly. This is a holoprosencephaly. You can see there is a monoventricle instead of two. There is a single ventricle, and you can see that this you cannot see clearly because these are the black and white pictures. This newborn having a single eye and not develop mouth or nose, this is called cyclopia. So cyclopia and monoventricular cavity, they are associated with what? They are associated with holoprosencephaly. Now dear students, let's discuss lesencephaly or agyria. Lesencephaly or agyria. Agyria means that there is absence of the gyrus or gyrus. Normally in the brain there is a presence of the gyri and sulci, but when there is absence of gyri, it is called agyria, and it is also called lesencephaly. So what is the etiology? How the lesencephaly occurred? Due to three main reasons. One is fetal alcohol syndrome. Fetal alcohol syndrome. The second is in utero HIV infection. In utero HIV infection. The third is LES1 gene mutation. So these three are the most important for the etiology of the lesencephaly or agyria or agyria. Fetal alcohol syndrome, in utero HIV infection, LES1 gene mutation. Normally the brain having a gyri and sulci, but when there is a mutation in a LES gene, when there is a mutation in what? When there is a mutation in the LES gene, the brain's shape is flat or agyria. So this is called lesencephaly. You have discussed the etiology. You can see these two pictures. This is lesencephaly. This is a normal brain. Normal brain having a gyri and sulci, but here there is no gyri or sulci, flat brain. It is a lesencephaly. Now move towards the third disorder, that is called a neuronal migration disorder, and this is also associated with the forebrain anomalies. Group of disorder where neuronal migration is defective. Neuronal migration is defective. It means that neurons are not migrated to a specific place during uterine life. When neurons are not migrated to a specific place, it is called neuronal migration disorder. How it happened? Due to the defective, normally neuronal migrations get completed by 12 to 16 weeks of intrauterine life. During intrauterine life, the neuron migrates to its own places. But if in intrauterine life, during 12 to 16 weeks, neurons didn't migrate to a specific place, this disorder we will call neuronal migration disorder. And beloved students, what is the etiology here? Here the etiology is DISC1 gene mutation. DISC1 gene mutation is also called double cortain gene. And remember, if an examiner asks which gene mutation is common in neuronal migration disorder and lesencephaly, your answer would be LES1 mutation. The third is filamin A1 gene mutation. So this is etiology. If somebody asks that, doctor, give me examples of neuronal migration disorder, so your answer would be lesencephaly, holoprosencephaly, microgyria. Microgyria means that there are small numerous gyri or gyri. the neuronal heterotropia. Neuronal heterotropia means that abnormal neuronal migration to abnormal site. Abnormal neuronal migration to abnormal site is called neuronal heterotropia, and this was a question. The fifth, it is very important, agenesis of corpus callosum. Agenesis of corpus callosum means not a proper formation of the corpus callosum. Like you can say that normally, like this is a corpus callosum connect two hemispheres. Now there is a agenesis. Agenesis not properly developed. You can see here in this picture. Now you can see there is not a proper connection between these ventricles. So there is agenesis of the corpus callosum. Agenesis of corpus callosum, grossly, if you see under microscope, the mismatched ventricle, misshaped ventricle, gross or radiology, or you can see a thin corpus callosum or ill-defined corpus callosum. So now you can say that this picture is looking like a bat wing. So therefore it is called bat wing deformity, or due to misshaped ventricle. It is also known as racing car sign, and this was a question in one of the exam. Now let's move to the posterior fossa anomaly. We have discussed anterior fossa anomaly. Let's discuss posterior fossa anomaly. Here you can say Dandy-Walker malformation. But before Dandy-Walker malformation, let's see this bat wing deformity. This is a bat wing deformity. I will provide this in the PDF. If you want to contact me, I will provide all these, and I will provide all these in a colorful form. Dandy-Walker malformation means dilatation of the fourth ventricle, not of first lateral ventricles or third ventricle. Dilatation of the fourth ventricle. When the fourth ventricle is dilated, for example, let's say these are the lateral ventricles. Now this is the third ventricle, and now there is, for example, this is a fourth ventricle. When this CSF flows from here to here, and now from here to here, this is for example, this is a fourth ventricle. Now when it dilates, more CSF will accumulate it here, more CSF. So this cystic dilatation of the fourth ventricle is called Dandy-Walker syndrome malformation. And when Dandy-Walker malformation, it is present in the posterior fossa, fourth ventricle. So there is an increase in the volume. When there is an increase in the volume, so it leads to hydrocephalus due to increased cerebrospinal fluid. Got it? Now the next one is Chiari malformation. Chiari malformation is due to cerebellar herniation. Cerebellar herniation are further divided into 4 types: 1, 2, and 3, 4. 1, where herniation of cerebellar tonsil. 2, herniation of cerebellar vermis. 3, occipital encephalocele. This is, I think, so this is wrong. This is occipital encephalocele. The fourth one is no cerebellar development. But remember, how will you differentiate Dandy-Walker malformation from Chiari malformation? There is also hydrocephalus. Hydrocephalus simply means when there is accumulation of the CSF or any volume inside the brain. This is called hydrocephalus. But how will you differentiate? Here is hydrocephalus, here is hydrocephalus. Here there will be a decrease in the posterior fossa volume due to the cerebellar herniation. Due to cerebellar herniation to the fourth ventricle, when, for example, this was a fourth ventricle, when cerebellar is herniated like here, so instead of more volume, less volume will accumulate here. and it will lead to decrease posterior fossa volume. Decrease posterior fossa volume. This is a differentiated factor. Here increase posterior fossa volume, here decrease posterior fossa volume. Got it? So enjoy the lecture.